Section 1. The Unseen Clock. Why bleeding demands immediate action. Welcome to the EmpowerAfriq Foundation's first aid course on controlling bleeding and wounds. Today, we are focusing on Unit 3. Stop the bleed. In any emergency, time is a critical factor, but when it comes to severe bleeding, every single second truly counts. An uncontrolled bleed can become life-threatening in a matter of minutes. The human body has a limited supply of blood. Losing too much too quickly can lead to a state of shock. Shock. Vital organs no longer receive the oxygen they need to function. This is why knowing how to act swiftly and correctly is not just a useful skill. It is a life-saving one. For a family member, for a colleague, for a complete stranger. Imagine a simple accident. A deep cut from a kitchen knife, a fall during a children's game, a more serious incident like a car crash. In these moments, panic can easily set in. However, the most powerful tool you can possess is knowledge. Understanding the immediate steps to take can turn chaos into controlled, effective action. This course is designed to empower you with that knowledge. It will give you the confidence to step forward and help when it matters most. Controlling bleeding is one of the most fundamental and impactful first aid skills. It bridges the gap between injury and professional medical help. The problem is not just the physical injury, it's the fear and uncertainty that accompany it. Many people hesitate because they fear doing the wrong thing. They worry they might make the situation worse. Our goal is to replace that fear with clear, calm, practical instructions. This video uses a problem-solution approach. We will present the problem, a bleeding wound, then provide step-by-step solutions to manage it effectively. Information is presented to be easy to remember under pressure. Throughout, you'll see the EmpowerAfriq logo, a symbol of accessible, life-saving education. We will use clear written headings and numbered steps on screen to reinforce key actions. Our tone is calm and reassuring. We want you to feel prepared, not overwhelmed. By the end of this unit, you will know you don't need to be a medical professional to save a life. You just need the right knowledge and the courage to act. Let's begin this journey together and learn how to stop the bleed. Section 2. Your Guide to Action. Introducing Unit 3. This unit, Stop the Bleed, is designed for everyone. Parents, teachers, community leaders, construction workers, anyone who wants to be prepared to handle an emergency. You do not need any prior medical training to understand and apply the techniques we will be covering today. The skills taught in this course are universal, from minor cuts in the home to more severe injuries in public spaces or remote areas. Our primary goal is to make first aid knowledge accessible and straightforward, empowering you to be a capable first responder. Our approach in Unit 3 is structured and methodical. We will begin by helping you identify the problem. Learn to recognize different types of bleeding and understand the immediate risks. Once you can identify severity, we move to the solution. A clear, step-by-step guide to controlling bleeding, starting with life-saving actions for major wounds, applying direct pressure, using tourniquets correctly, packing deep wounds. We will break down each technique into simple, manageable steps. Then we address care for more common, minor wounds. Proper care prevents complications like infection, which can worsen a small injury. How to properly clean a wound, choose the right dressing, and recognize signs medical attention is needed. This approach prepares you for a full spectrum of injuries. The problem-solution framework keeps things practical and action-oriented. The purpose of this unit is to build your confidence. With clear instructions and a calm approach, anyone can learn to manage a bleeding emergency. This video is your guide, with simple, visual demonstrations. We will show you what to do, explain why, and highlight common mistakes to avoid. By the end, you'll have a solid foundation of skills and the self-assurance to use them. You'll be equipped to step up, take control, and provide critical aid until professional help can take over. Table of Contents. Part 2, Act 1, Types and Risks. About 4 sections. Seeing the unseen, identifying different types of bleeding. From scrapes to slices, common causes of wounds. Reading the signs, how to assess the severity of a bleed. Understanding the stakes, key risk factors in bleeding injuries. Section 1. Seeing the unseen. Identifying different types of bleeding. To effectively stop a bleed, you must first understand what you are dealing with. Arterial bleeding is the most serious. It comes from an artery. This blood is under high pressure, so it will often spurt out in rhythm with the person's heartbeat. The blood is typically bright red because it is full of oxygen. Recognizing this type of bleeding is critical because a person can lose a life-threatening amount of blood very quickly from a damaged artery. Venous bleeding occurs when a vein is cut. Veins carry blood back toward the heart, so the blood is under less pressure. The blood will flow steadily from the wound. The color of venous blood is usually a darker maroon red. Venous bleeding can still be very dangerous. Treat with the same urgency. Apply firm and consistent pressure to control the flow. The most common type you will encounter is capillary bleeding. Capillaries are the smallest blood vessels. This bleeding is characterized by a slow ooze or trickle. Because the pressure is very low, capillary bleeding is usually easy to control. Clean the wound properly to prevent infection. Finally, we must consider internal bleeding. This happens inside the body and is not visible. It can be caused by blunt force trauma, such as from a car accident, a hard fall, or a severe impact during sports. Internal bleeding is extremely dangerous because it is hidden. Recognizing the signs of internal bleeding, which we will discuss later, is a crucial skill. Section 3. Reading the signs. How to assess the severity of a bleed. The most obvious sign is the appearance of the blood itself. Observing the color and flow of the blood gives you immediate clues about how serious the injury is. It is also vital to watch for the signs of shock. Shock can be a direct consequence of significant blood loss. Pale skin, cool skin, clammy skin, weakness, dizziness, confusion, rapid, shallow breathing, fast but weak pulse, nausea, thirst. Recognizing these signs of shock is extremely important. It means the person's condition is critical and they need immediate medical help. Look at the wound itself. Look at the blood. Look for signs of hidden bleeding. And finally, look at the person's overall condition. Are they showing signs of shock? A person who is bleeding heavily, appears pale and confused, and has a rapid pulse is in grave danger. Section 4. Understanding the stakes. Key risk factors in bleeding injuries. One of the most critical risk factors is the location of the wound. An injury to the torso, the chest, abdomen, or the neck, or armpit, can sever major arteries. A person's age and overall health also play a significant role. Very young children and elderly adults are more vulnerable to the effects of blood loss. The use of certain medications is another major risk factor. Many people take medications that thin the blood. If you are helping someone who is bleeding, it is helpful to ask if they are on blood thinners. Let's consider a short scenario. An elderly man on blood thinners falls and gets a deep cut on his forearm. Recognizing these risk factors immediately tells you that this is a high-stakes situation requiring aggressive and immediate action. Section 1. First, do no harm, ensuring scene safety and personal protection. Before you rush in, take a brief but critical moment to assess the scene for your own safety. You must not become another victim. Next, personal protection. Blood can transmit germs. If a first aid kit is available, put on disposable gloves immediately. No gloves? Improvise. Use waterproof barriers like plastic bags or multiple layers of clean cloth. After protection, call for help immediately. With others, point and be specific. You, in the blue shirt, call for emergency services now. The most important and effective technique is applying direct, firm pressure to the wound. Use the palm of your hand to apply steady, strong pressure. Do not be afraid to apply significant force. Maintain this pressure continuously. Do not lift the dressing to check. If blood soaks through the first dressing, do not remove it. Add another layer on top and continue firm pressure. If wound is on a limb, an arm or a leg, elevate it above the heart while keeping pressure. But direct pressure is the most critical action. A tourniquet should only be used for a life-threatening bleed from an arm or a leg that cannot be controlled by direct pressure. Place it on the injured limb about 2 to 3 inches above the wound. Never place a tourniquet directly over a joint. Once it is on, do not loosen or remove it. For deep wounds located in areas where a tourniquet cannot be used, wound packing works by filling the empty space of the wound cavity. Start by taking one end of the gauze and firmly pushing it all the way down to the deepest part of the wound. Continue feeding the gauze into the wound until the entire wound cavity is filled. Once the wound is completely packed, apply direct, firm pressure on top. After you have taken steps to control the bleeding, your next priority is to manage shock. Have the person lie down flat on their back. Carefully elevate their legs. It is crucial to keep the person warm. Cover the person with a blanket, a coat, or whatever is available. While you are waiting for emergency services, you must continue to monitor the person's condition closely. Reassure them and try to keep them calm. Properly cleaning a minor wound. Before you touch the wound, wash your own hands, rinse the wound itself under cool, clean running water. After the wound is clean, gently pat the area dry, covering and protecting the wound. The next step is to cover it with a suitable dressing. It helps to keep the wound clean, it protects it from further injury, and it absorbs any minor oozing. When to seek professional closure, some wounds require professional medical attention for proper closure. If the wound is deep, if the edges of the cut are gaping open, wounds located over a joint, if a cut continues to bleed through dressings, recognizing and preventing infection, monitor for infection, increasing pain. The skin around the wound may become increasingly red. The area might also feel warm. Swelling that gets worse. You might see pus. The person may start to feel generally unwell and develop a fever. If you notice any of these signs of infection, it is crucial to seek medical attention immediately. Let's summarize the most critical steps. Recognize the problem. Ensure the scene is safe. Act fast. For any significant external bleeding, the foundational solution is to apply firm, direct pressure. In cases of severe, life-threatening bleeding from a limb, apply a tourniquet. For deep wounds in other areas, wound packing. The goal of this EmpowerAfriq unit has been to build your confidence. The knowledge you have gained is the foundation of this confidence. We encourage you to take this knowledge and make it your own. Seek out hands-on training courses. The more people equipped with these simple first aid skills, the safer the community becomes. You now have the power to make a profound difference in someone's life. Remain calm. Act decisively. Thank you for joining us for this EmpowerAfriq first aid course. You are now better prepared to protect your community and to be the help until help arrives. Stay safe and be ready.